As Ed said, I'm Sarah, and this evening I'm going to be talking to you about the bleeding horse, or blood loss, however you like to say it. So during the presentation, we're going to cover where you might expect to see a horse bleeding from, but also where you might not see a horse bleeding from, and this can be equally as important, if not more so. We'll also cover how to decide whether you're going to need a vet or not, what you can do while we're on our way, and what to expect from us when we arrive. So where do we usually see blood loss? It seems like a pretty obvious place to start, and the answer is, in its most basic form, a horse can bleed from anywhere. However, there are places where we commonly see blood loss. Sometimes it looks serious but may not be, and conversely, it may sometimes not look that bad when in actual fact it could be. So most often we attend a bleeding horse that have been injured, they've injured themselves, or they've been injured by somebody else. As in a general rule, the further the injury is from the heart, the less likely it is that the horse will bleed enough to be too much of a concern. Wounds can be large and the blood loss is still not that extensive. That being said, you're likely to need veterinary assistance regardless to deal with the wound itself, so the bleeding can be managed secondarily in this case. Nosebleeds are potentially the next most common source of concern, and there are plenty of reasons why a horse may be having a nosebleed. Again, some serious and some not so serious. I've outlined a few causes of nosebleeds here, but there are plenty more. Generally speaking, a one-off nosebleed is of little concern as long as it's stopped in a timely manner. However, regular nosebleeds, no matter how small, should always be investigated. So one that we've got here, exercise-induced pulmonary hemorrhage, or EIPH, you might hear. It's something that we usually see in racehorses, and occasionally we see it in sport horses as well. It's caused when the small vessels in the lungs burst during high-intensity exercise. And quite often there's no evidence, but sometimes you might see a varying amount of blood out the nostrils. Trauma is the second one down on the list here. And so the same as us, if a horse bumps its nose hard enough, it could bleed. There are lots of blood vessels in the nasal passages that can burst following trauma. And it goes without saying that horses' noses, they're bigger than ours, and some horses are pretty clumsy, so it figures that we see trauma-related nosebleeds fairly commonly. Ethmoid hematomas, again, pretty rare, but they're one of the reasons why we say that regular nosebleeds should be investigated. They're actually locally invasive, non-neoplastic masses that form in the nasal passages, and they're much better dealt with sooner rather than later. And then finally on my list here, guttural pouch mycosis is another rare but quite serious condition that we see in horses, and it can actually be fatal if we leave it untreated. This disease is the main reason we say that regular nosebleeds shouldn't be ignored. Clinical signs would be sporadic nosebleeds that get worse over time. And how it happens is a fungal infection establishes itself in the guttural pouches, which are at the back of the throat. The fungal infection eats away at the structures within the guttural pouch, which include a large artery, and this is where the disease can be potentially fatal. If the artery is damaged past a certain point, the horse can bleed to death, and we can rarely intervene in time, unfortunately. So other things we've got on the list: after surgery, a horse can bleed from any surgical site in theory, and you will be educated in this at discharge from the clinic following the procedure, if it's likely possibility and what you should do about it. And then also castrations. A common site of bleeding is after a castration. Again, you'll be talked through it at the time of your horse being gelded, and signs to look out for and what to do will be discussed through with your vet. And then finally down here, we sometimes see blood in the urine and the feces. It's uncommon and it doesn't necessarily constitute an emergency, but it is somewhere that we can see blood loss. So now that we've covered where you can see the bleeding, it's important to consider places where you might not see the bleeding, but the consequences, if left unchecked, can actually be more serious. The abdomen contains lots of large organs and lots of major blood vessels, which can occasionally rupture. These vessels don't typically rupture spontaneously, but instead tend to rupture following certain incidents. So the uterine artery is closely associated with the female reproductive tract, and a difficult birth, or sometimes even a simple birth, we can see the rupturing of this artery in the mare. Mesenteric vessels are blood vessels that are within the intestinal tract, and they can come under pressure sometimes during a particularly nasty colic episode. And then the aorta is the main artery leaving the heart. And while it's a thick-walled blood vessel, which is usually very strong, it can rupture in athletic animals performing high-intensity exercise, Unfortunately, this is invariably fatal. There's not a lot we can do about it. The liver and spleen can be damaged during accidents or trauma. They are highly vascular, and depending on the degree of damage, they can bleed an awful lot in horses. And then on the previous slide, we did touch on bleeding into the lungs. It can go unnoticed for a period of time due to the distance that the blood would need to travel before it can be seen. This wouldn't necessarily constitute an emergency, but may result in a horse becoming chronically anemic in occasions. And finally, some kind of traumatic incident, blood can be lost into the muscles. So this may be following a slip, a collision, or a fracture, as seen in this photo here. This will often form a hematoma or a bruise within the muscle. And blood loss in this case is not often that much, but can be difficult to quantify because of the extent of the bruise cannot be accurately defined. An exception to this rule would be for a horse that has suffered a pelvic fracture. This is a condition commonly associated with racing thoroughbreds again, and there are very large blood vessels around the pelvis, and if a pelvic fracture displaces, the bone fragments can sever these major vessels. It is possible for a horse who has a severe pelvic fracture to bleed to death, unfortunately. We would always recommend that a horse with a severe pelvic fracture is examined by a vet and handled very carefully. So how much blood does a horse have? Thought we'd just cover that a little bit to give you a bit of an idea of what you're looking for. So yes, to give you a rough idea of how much blood a horse has, and hopefully to reassure you that it may look pretty bad, but the horses actually have quite a lot of blood, and they can stand to lose a little bit. So depending on the type of horse, they have a varying volume of blood per kilo of weight. So you can see here the thoroughbreds have 100 mils per kilo, the lighter breed horses like warm bloods have 78 mils per kilo, and the draft horses like Shires or Clydesdales, they have 61 mils per kilo, typically, rough values. And this is ultimately because blood volume dictates how much oxygen can be transferred around the body. So the so-called hot-blooded horses, the highly athletic breeds like thoroughbreds, they have the highest volume of blood for their weight, and the cold-blooded draft breeds have the least. Interestingly, as you can see here, this means that the volume of blood of a horse doesn't vary necessarily as much compared to their weight as you might expect. Okay, so the big question, how much horse can a horse lose? Or, reading between the lines, at what point should you start to be worried? A horse can lose 15% of its blood volume and cope quite well. They'll replace this volume over time, and unless you try to take your horse for a blast at the gallops, it's not advised, you'll probably not notice anything at all. It's like going to donate a pint for yourself. And then 25 to 30% of losses, depending on how healthy your horse is, may mean that he or she is a bit under the weather, but may actually not need any medical intervention, just some TLC and an easy time of it for a week or two. So again, this slide is just to demonstrate to you, based on blood volumes of each breed I gave you earlier, what 15, 25 and 30% of a horse's blood volume looks like in litres. And a little picture over there, a standard bucket full to the brim is roughly 14 litres, for those of you that might struggle to imagine what that volume would look like. While it may not seem like that much, I can tell you it takes a fair while for a bucket to fill up, even when the blood seems like it's flowing at quite an alarming rate. So, just before I give you some of the first aid advice that you can put into practice and how we can patch up your horse, just going to quickly touch on what stops the bleeding. So first and foremost, nature. It's very clever, and no living thing is designed to bleed for very long if they can help it. This diagram here is actually a simplified version of the complex pathway that happens inside a horse when it springs a leak. Chemicals within the blood, called clotting factors, are activated in an organised fashion, and the aim being to form a clot around the area that is injured and plug the hole. This is the body's way of stopping bleeding naturally. So pressure applied to an area that is bleeding can occlude the damaged blood vessel and prevents more blood flowing directly to the injury. This slows down or stops the blood flowing past the injury and allows the area to clot and for the clot to stick to the area. Pressure can be applied by yourself, or can sometimes happen when a particular space within the body becomes full of blood. So for example, if a horse were to be bleeding into a muscle, at some point the pressure outside the blood vessel becomes equal to the blood pressure inside the muscle, and then the flow stops moving from inside the veins to outside. So this results in the flow of blood slowing and allows clotting to occur. And then finally, and I won't linger on this one for too long, it is a fact of life that without a certain volume of blood, we cannot continue to live. Organs are not perfused with enough oxygen and the body shuts down. There are occasions when an injury is so great, there is simply nothing we can do, although we obviously endeavour to avoid this being the case at every opportunity. So how do you know whether you can see the blood or not, whether your horse might be in trouble? The term used for any mammal that does not have enough circulating volume of blood is called hypovolemic shock. Hypo being not enough, and volemic, literally volume. And shock is the term used when the body's coping mechanisms are no longer working and organ function begins to decline. So clinical signs that we associate with shock would be tachycardia, which is a fast heart rate, tachypnea, or fast breathing, weak pulses, and the pulses can be felt either under the angle of jaw or on the back of the fetlocks, which a lot of you are familiar with. We also see pale to white mucous membranes, and the easiest ones of those to check on a horse are the gums. Your horse may be sweaty or clammy to the touch. It may have cool extremities like feet, ears, and nose. And then the other thing that we can see is altered mentation or behaviour. And this can manifest in your horse being quiet and subdued, or in some cases, horses can be quite anxious and restless. If your horse is exhibiting any few of these signs at the same time, it should ring alarm bells, and it's probably time for a vet to come and have a little look at your horse. It's important to say that at this point, these are signs you would typically see if your horse loses a significant volume of blood in one go. If a horse were to lose a similar volume of blood, but over a period of time, the body can accommodate these losses and adapt. So it very much still needs investigating, but would not necessarily be considered as serious an emergency as acute blood loss. Okay, so what on earth do you do if you find your horse bleeding? First and foremost, try to stay calm for your horse and for us to be able to give us as much information as possible. It can look scary and feel very overwhelming, but if you can take a deep breath and gather your thoughts, you can hopefully turn the situation around and have the best possible outcome. What if I feel queasy at the sight of blood? That's a common question that we get asked, and that's fine. That is okay. Not everyone can help it. It's quite common, and especially if it's your own horse, that never helps. So ask for help from somebody nearby if you can. Give them clear instructions what you need them to do, and excuse yourself or look away. Just look away from the situation to make a phone call to the vet. Trying to keep the horse calm is a key player when dealing with a bleed. If you allow your horse to get stressed, try to move it too far or aggravate the injury, you may increase your horse's heart rate and hence increase the rate at which the blood is flowing past the injury. This potentially means that you end up losing a little bit more blood. If possible, apply firm direct pressure to the site which is bleeding. If it's an area that can be bandaged, this is a very good option. A small dressing to soak up the blood and a vet wrap should be sufficient in the short term. The dressing can be applied quite tightly until the bleeding has stopped or until the vet arrives. You're unlikely to cause too much harm in the short term with a tight bandage. If there's strike through on the bandage, apply another layer over the top rather than remove the dressing underneath. This helps to continue the blood clot to form. For an area that can't be bandaged, apply firm direct pressure with a clean towel or similar and just hold it on there with your hand. Ask somebody to help you if you're trying to settle the horse and the injury is far from its head. So once you've hopefully managed to get the bleeding under control, give us a ring. I'll go through the kind of information that you may need to inform the vet or questions that they may ask you in a few slides' time. If you can, keep all the material that you've used to clean up in one place. Equally, if the blood is dripping, try to catch it in a container. This allows the vet to roughly quantify how much blood is lost when they get to you. And finally, look after yourself. It's very important. If a horse has suffered a large volume of blood loss, they can panic, they can go into survival mode, or they can become quite wobbly on their feet. So if you're concerned that your horse is behaving unusually, put them in a stable and observe over the door. It's most important that you stay safe in the situation. It always feels like you might need to be there to do something about it, but if you can step out and just tell us what's happened, that's much more helpful than we're picking you up off the floor as well when we get there. So if in any doubt at all, call the vet back, explain what's happening, and they can try to advise you further on the best course of action before they get to you. Just a quick overview of your bleeding horse specific first aid kit. So we've got cotton wool in the corner, something absorbent to soak up the blood with. We've got these little melanins, like a clean dressing just to apply pressure over the wound. A vet wrap or an alternative bandage to secure the dressing tightly. A stethoscope to take the heart rate, or you could also count the pulse in the areas that I told you about earlier. And then the hay net here represents something to keep your horse settled. So that might be a hay net, it might be a lick, or it might just be you being there. So what can you tell us over the phone that will allow us to assess the situation as best as possible and be on our way to in a timely manner? Is the horse still bleeding? It may look like a massacre has occurred, but if the bleeding has stopped, the urgency is reduced. Where is the blood coming from? This helps us determine whether your horse may genuinely be at risk or whether the situation might look worse than it is. It also allows us to make a plan of action while we're on our way to you. Is the blood dripping, pouring, or spurting? We may take different approaches depending on the answer. There is a common phrase that you might have heard that goes, if you can count the drips, you're likely to be okay. This means the bleeding is not profuse, it's likely from a vein and shows promise of stopping without too much issue. Pouring or spurting blood could well be arterial, and it is an emergency. A rough estimate of blood loss, again, allows us to gauge the level of urgency and plan our approach while we're on our way to you. And then finally, seems like a silly thing to mention, but do we need a gate code to get into your property? If you're tied up with nursing your horse or managing the situation, and you can't answer your phone when we get to the gate, it just lengthens the time that we can be there to come and help you out. So we might still ask you a few questions over the phone before we set off, and the reasons are as below. The questions aren't designed to get all the information we can get when we get to you, but just enough to allow us to spring into action as soon as we can. It also allows us to determine whether we may need a pair of extra hands, whether we'll need equipment or medication delivered to us at the yard by somebody else, and also helps us to find you without getting lost on the way. So what can we do when we get to you? First and foremost, we can back up the first aid that you've already hopefully administered, or provide immediate first aid to try and stem the bleeding if you've had a bit of a difficult time with it. We can also provide medication to help with blood clotting and often sedation to help settle your horse if appropriate. Secondarily, we can assess the location of the injury or the blood loss, determine the severity of the blood loss, and see how your horse is faring with a clinical exam. All vets have the necessary equipment to restore circulating volume to a degree in their car. Horses begin to struggle when there's simply not a large enough volume of fluid in their veins, and so using plain fluid to replace some of the lost blood can improve the state of your horse quite dramatically. After this, we can make a plan with you going forward. Your horse may need a stitch-up, it may need a few days of nursing care in the clinic, it may need some imaging to determine the source of blood loss or extent of an injury, and worst case scenario, your horse may need a blood transfusion. If the volume lost is just too much for your horse to replace on its own, it will likely come hand in hand with some hospitalisation and a bit of nursing care, just to get the horse through. It's important to say that if the source of bleeding can be identified and stopped, with good aftercare, many scenarios lend themselves very well to a positive outcome for your horse. So take-home message, a little blood goes a long way. If you're in any doubt at all, give us a ring. We're always happy to advise if it doesn't immediately appear that a visit is necessary, and obviously we can change the plan as we need to. Any questions?
Thank you, Sarah. That was really informative, very interesting, well presented talk with some very useful information and some handy tips. Just a couple of questions. We're often taught when you have a horse with a wound that one of the things that you would do with that wound is maybe put a hose on it and give the wound a hose to keep it clean. What's your feeling about that in terms of stimulating further blood flow? Is it a good idea or a bad idea?
So in theory, yes, very good idea. It helps to get rid of all the dirt and any bacteria in the wound. I suppose if there's any question at all, you can just ask when you're on the phone, do you think it's a good idea? Explain where the wound is. 9 times out of 10, it is a great idea, but sometimes it might wind the horse up, or it might mean that they, we just make the wound a little bit worse. So there may be scenarios where it's not necessarily the best idea.
One person has asked about the use of twitches as far as keeping a horse quiet if it's getting stressed. What would your thoughts be on that versus using, they've asked about a calming cookie, but I'm guessing that's a lick or something like that.
So I'm not sure I would necessarily go straight in for a twitch to try and keep your horse calm, purely because we might be half an hour away. Keeping a twitch on for half an hour can sometimes aggravate the horse further. Although if it's something that that keeps your horse calm and the vet's not very far away, then it's certainly worth giving it a go. But if there's any situation, if the horse is getting itself aggravated or wound up, you're better off trying to bribe it with something, a calming cookie. They take a little while to kick in, but they might just keep your horse interested in something else. Or just keeping a calm, quiet nature around the horse is quite often quite a good idea.
Thank you. We all know about replacing blood after you've lost blood by blood transfusions, and one person's asked about their horse becoming a blood donor. Can you just give us a quick chat on how we choose horses to be blood donors and the process that we follow to do that?
I certainly can do. So we do, yes, we have some blood donors on our books. They are typically horses that are over 600 kilos, usually geldings because of the way the antibodies work. And we're usually looking for a healthy horse that doesn't necessarily have a busy job to do, so that they can have some rest and recuperation after giving blood. A blood donor horse would typically give 12 litres, up to 12 litres at a time as needed. And they get lots of praise and lots of cuddles. So it's a very heroic thing for a horse to do. But there are some categories that they have to fulfill.
Thank you. One other question: have you ever experienced a horse faint from blood loss when you've been dealing with it, when you're stitching one up or anything like that?
Not faint per se. I think the term fainting probably refers to people where they sort of can imagine the situation, or they can faint at the sight of their own blood. We don't typically see horses behave in this way, but there are scenarios where obviously they've lost a lot of blood and that might cause them to faint just purely because of volume loss. One
of the questions I always get asked is about hematomas. So when a horse has a bleed under the skin, so it's maybe bashed a muscle or something like that, and you've ended up with a very, very large hematoma, which could almost be half a bucket in volume. And I'm always under a lot of pressure to drain those hematomas. What would your advice be on when you actually do drain a hematoma?
So yes, I've been asked similar questions myself. Quite often we get them where if they've been kicked on the rump or something like that, we'll get a big swelling. And actually they are best left alone if at all possible. So when a hematoma forms, the skin is closed, there's no bacteria in there, it's a sterile environment. So the horse will resorb the blood in its own time. It can reuse all of the components in the blood, so it keeps the iron, and it can reuse everything. If we drain a hematoma, we can encourage infection into the site, and then you end up with a swollen muscle with lots of bacteria in it, which can end up being an abscess. So they are unsightly, but usually best left well alone.
Oh, that's good. It sounds like I've been doing the right thing. That's great. Thank you. One other quick question, and then I'll stop torturing you. What are your experiences of using drugs such as tranexamic acid in treating horses that have got blood loss? I know that we've been using it for quite a long time in the veterinary world, and they've been more recently getting excited about it for treating ladies postpartum after they've given birth when they've been bleeding and things like that. Have you had much experience of using it for horses that have bled heavily?
So yes, I have. I typically wouldn't necessarily say that it does the job that we need it to do. I would say that though, because I find quite a lot of the time it gets reached for when the situation is quite serious. So the horse is bleeding quite profusely, and we're trying to we're trying everything. I have used it in quite good success following a castration when they're bleeding. The bleeding is relatively limited, and it can just help to clot the blood faster. So in the situations where actually I think we have a good chance of stopping it anyway, it definitely helps to speed up the process. Sometimes it doesn't work, and that's simply because we haven't used it in a situation where it's likely to work, unfortunately.
That's great. I am going to ask you one more quick question. I'm sorry, because somebody's asked it and it's actually quite a good one. How do you identify quickly that a horse is bleeding internally? Is there anything that you can do? Are there any diagnostic tests that we can do to identify blood inside a horse?
Yeah, good question. So we can do a peritoneal tap if we are concerned that they might be bleeding internally. Like I said, it doesn't usually happen spontaneously, but there are exceptions to the rule. So a peritoneal tap would probably be the easiest and quickest way to find out whether there is frank blood in the abdomen, and that involves putting a little needle just in the lowest part of the belly, and we take a sample of the fluid that's surrounding the intestines there. And you can generally see straight away whether that is bloody or whether it's yellow and straw coloured, which is normal. And then the other thing is clinical signs. So if a horse is bleeding into its abdomen, we don't usually find it's bleeding a little bit. It's usually bleeding quite a lot. So their heart rate goes up, and they get a bit pale, and they can sometimes get a little bit restless as well.
Do you ever use sort of ultrasound or anything like that to make a diagnosis of a lot of free fluid in the abdomen or the chest?
Yep, we can certainly use ultrasound. That will tell us that there is fluid in the abdomen. We can see increased fluid, and there are certain areas where we would scan where we know that if there is increased fluid, that's sort of where we pick it up. But ultrasound isn't necessarily very good at telling us what that fluid is, and that's where the peritoneal tap comes in.
That's brilliant. Thanks, Sarah. There's some good answers. It was a really good talk. It was very scary. We're going to move from one scary talk to another scary talk, and we're going to